If you suffer from thyroid eye issues, it's great to know that there is a renowned expert right on your doorstep. So I'm here today to meet with Dr. Raymond Douglas to hear more about the condition and the treatments available to you. If you could share with me and enlighten some of our audience members as well, exactly what thyroid eye disease is and how it occurs and what are the kind of issues that might arise from that.
Sure. So thyroid eye disease is something that occurs as an autoimmune condition. It actually occurs from your bone marrow where it attacks both your thyroid and your eyes, thus the name. Mm-hmm. And it goes along with thyroid, but it's very different. It comes as a bulging of the eyes, red, often even mistaken for an allergy and can go undiagnosed for a few months. But it causes severe disruption of the eyes because the tissue around the eyes is being attacked by the immune system. It's causing swelling and it's causing double vision, causing the eyes to bulge, and even the face can change quite a bit. So thyroid eye disease can look like an allergy or even something relatively minor, but it really transforms the face and the eyes, but can be treated very well.
Yeah, severe cases can obviously be pretty obvious to look at, especially from a professional's point of view. What should people be looking out for, though, in signs of, against irritation to what may be precursors to a condition leading to that disease?
Yeah, so about 80 to 90% of patients with thyroid eye disease also have a thyroid dysfunction. So if you have a thyroid problem, whether that be high thyroid or low thyroid, and you start to see changes in the mirror of your eyes start to look red all the time. They start to look a little bulgy. You start to see big bags underneath the eyes. And you just can't explain that, but that appears to be progressive. Especially if it's worse in the morning and gets better during the day, then it's time to actually be evaluated. Usually you'll see some of these signs associated with the thyroid abnormality. Again, 10% or so patients don't have any thyroid problems, but they see these progressive changes. If you've been trying to be diagnosed with allergies for 3 or 4 weeks, it's time to probably consider something else.
Right, obviously they need to come and see you. You're one of the leaders in the field, like I said. What does treatment look like for someone suffering with TED? And also, can you share a little bit more about the medication that you're leading the way with as well?
Sure. So treatment really I summarize as 3 possibilities. One is to do nothing, just use some artificial tears, some supportive therapy, etc. And some patients opt for that. Most patients, though, think of the other 2 options. One is a medical treatment and the other is a surgical treatment. The medical treatment we often start with because it actually blocks the immune system's attack very specifically just on the eyes. So it has relatively few side effects to the rest of the body, but blocks and reverses this disease. So someone's eyes are bulging out or double vision, it will reverse that and they'll look relatively normal within just a few treatments. And it's all because of this targeted IV therapy. If that fails, or sometimes we have to augment that, then we can do surgery. Surgery sometimes is a little more daunting for patients because we have to remove some of the tissue behind the eye and move the eyes around and do some things to make them look better, but it can be transformative and all can be done in one single surgery.
Now, you serve patients who fly in from all over the world to come and take advantage of your expertise. You have offices in California as well as here in Southern Nevada. What does it look like when they come in for treatment?
Yeah, so the most important thing is really providing concierge one-on-one care and being available. We don't want to have a wait list for 4 months to see us. We guarantee that you'll be seen within 2 weeks and be evaluated so that we can get on top of this condition right away. The first things I look for are really beginning to understand how this disease is changing, how fast things are progressing, how fast we may have to jump into treatment, and really kind of allay some of the fears that have been generated by Dr. Google. Usually patients come in very scared, but we understand that and we really want to let them know that we're with them through this journey and we'll get there. And sometimes there's highs and lows, but usually we can do quite well on this journey of treating them for thyroid eye disease.
And where do our viewers need to go for more information about you and about the options available to them? And is there anything else you'd like them to know before they hit the website?
Sure. I think the most important thing is make sure you're seen by a physician who really understands thyroid eye disease. There's a lot of misinformation, there's a lot of anecdotal information, especially on social groups, etc. Really make sure that you do your homework and get a medical professional input upon seeing you. Every treatment should be customized. And then feel free to reach out to us. We do Zoom appointments. 50% of my patients are outside California and Nevada. And so we do Zoom appointments. We can diagnose things, and we can really kind of take care of about 95% of things without even seeing patients in person. An inpatient visit is really great, but there are alternatives for patients really getting the care they need.
And to get more information, what's the website address?
Sure, so it's RaymondDouglasMD.com.
And there's a list of information on there, obviously, with everything with the services you offer, and also, you know, signs for people to look out for.
Absolutely, and also even a patient questionnaire where you can submit just, you know, online, and we'll get back to you within 24 hours. But also kind of a discussion of the blogs, of frequently asked questions. Is this covered by insurance? The answer is yes, but it'll give you more detail of really how to track your treatment, how to get diagnosed, and what to do there afterwards.
That's great. Well, Doctor, thank you so much for your time today.
Thank you.